Hi, hello everyone, and welcome back to Little Warriors with Dr. Stalin. I welcome you, Dr. Stalin Ramprakash.
Thank you.
When your child has thalassemia, it is natural to look around for answers, and most of the parents often hear advices from either friends, relatives, or through the internet, which is not always accurate. And today, we are going to separate myths from facts. Well, doctor, could you tell us what is the most common myth parents come to you along with?
Sometimes parents wonder how the child got thalassemia, and sometimes they think it is an infection. It may go from one person to the other, which will not be the case. This is a genetic condition. So if either you are born with it, or if you don't got it at the beginning, you are not going to get it later. So children who are born with thalassemia are born with thalassemia. Those who did not will not get it later.
All right. Well, it feels like some parents think that if one child, like the first child or the second child, has the effect, like has been affected to thalassemia, they think that maybe another child is also going to be affected. So is that true?
Yeah, so if you look at the literature and the scientific evidence, it will be said that 1 in 4 children will get affected with thalassemia. That doesn't mean that that is a chance for every single child. So it doesn't mean that if the first child is affected, next child will not be affected. Still, there is 1 in 4 chance. Sometimes, if parents are unlucky, 2 children together can affected with thalassemia, or both may be carriers. They may have 3 children, and none of them may be affected as well. So it is all the chance of how the genes are passed on. So either for every single pregnancy or every single child, the chance of getting thalassemia is 25% or 1 in 4.
All right. So, doctor, could you tell us if a child is affected with thalassemia, can they go to school and interact with other children?
There is no reason why the child should not be like any other child without thalassemia. As long as the condition is well managed, the children should be able to lead a normal life and sort of do all the things what the other children are able to do.
All right. Doctor, another question that parents always wonder is, can the child be cured through natural remedies or should they have to follow any special diet?
Actually, there is no natural remedy. Like I said earlier, if you got it, you have got it lifelong. So it is not going to get cured by itself. So if you, unless the diagnosis is wrong, if you have been confirmed to have thalassemia, it will be there forever. You just have to manage it. So one is like giving regular blood transfusions and medications to keep the thing under control. The other option is a curative treatment is bone marrow transplant, but it will not get cured by any natural remedy or any other medicines.
Well, other than blood transfusion, is there any alternative treatments like that available?
See, there are some medicines which can be used to improve the hemoglobin in some patients. It will work in some patients, but not in all patients. But there is no curative treatment other than bone marrow transplant, or in the future, maybe gene therapy. But there is no sort of, sometimes there are a lot of advertisements and things like that. They will cure thalassemia or they will give some medicines. I would advise that not to go for any unproven treatment, because there is no proof that any of the other treatment works. But even in current medicine, there are some patients who will benefit from certain amount of certain drugs, which may make them transfusion independent, which is the aim. But that has to be closely monitored with regular blood tests and follow up. So there is no sort of non-scientific method of getting rid of the blood transfusions.
All right. And what about sports? Like, should the kids stay away from any physical activities?
No, see, thalassemia, as long as it is well managed, a thalassemic child should be able to do everything what any other child is able to do. And for anybody else looking at the patient, they will not see any difference between this child and another child. So an unknown person looking at the child should not be able to tell this child has got thalassemia. So they should be able to do every single thing. So their life is not limited because of thalassemia, other than the fact that they have to take blood transfusions and they have to take certain medications continuously.
Doctor, there is a very biggest worry of the parents that they wonder if their child is really going to have a successful future. So what do you want to say for that?
there is no reason why the child should not have a successful future. But it comes with a lot of hard work from the side of parents as well as from the side of the child, and when the child grows into an adult. It is all about managing the condition very well. As long as the condition is managed very well with the right people and they are very compliant with the treatment and following all the instructions, they should be able to do everything whatever a normal person is able to do.
Doctor, and the parents wonder, did this thalassemia come down because of something they did during the pregnancy?
Absolutely not. So, see, we all carry the genes, multiple genes, millions and millions of genes we pass on from the parents to the children. And this is not because of anything they did or they did not do during the pregnancy. It's just by chance phenomenon. So the two faulty genes, if they happen to come together, then the child develops thalassemia. It's nothing to do with anything happened during the pregnancy.
All right. Can the children, affected kid can eventually outgrow this thalassemia?
Again, this is a genetic condition which they are born with. If you are born with a severe thalassemia, they will not outgrow it. So either they have to manage the patient on a regular basis with the conservative management, or they have to go for a bone marrow transplant in order to cure the patient permanently.
All right. Doctor, what would you tell to the parents who comes up with these conflicted information through the internet?
Internet, sometimes a boon or a bane, depends on how you use it. Sort of looking for everything in the internet and expecting all the answers to come clear, sometimes it can be very confusing, because who puts out what in the internet is not controlled. So anybody can write anything in the internet. So even if you are using the internet, go to the correct resources, which is scientifically proven, or some certain bodies which give medical bodies which will give advice, and sort of go to the right places. And more than that, whatever you gain the information from the internet, better they go and discuss with their doctor and sort of find out very clearly what is right and what is not right.
Well, doctor, if you would want to give one message to the parents, then what would you tell them?
One of the things which an important myth, what most of the parents ask, or because they are worried about the iron overload, which has been repeatedly grilled to them, that iron overload is a problem. It is a problem, but it is not a problem if it is well managed. So they start avoiding things in the diet, thinking that, okay, if I give non-veg to my child, the child's iron overload will increase. That is not the case. What the iron we give through the blood transfusion is far, far higher than anything what you will give in the diet. So please do not restrict the diet of the child, thinking that you are helping the child. That is not a healthy way to do it. You discuss with your doctor and then sort of take the advice. Because that is the most misconception people have, and then they want to try to avoid the iron in the diet.
All right. Thank you so much, Dr. Stalin. Well, I believe that this was very useful to all the parents and they have got their answers. And I would tell, do not, rely on your hearsays through outside people. Instead, please contact with your healthcare team. And yes, this is Little Warriors. I'm going to see you in the next episode. Thank you.
Thank you very much.